Now we go to the back transporting points, bladder 18, the liver shoe. To locate, bladder 18 is 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the 9th thoracic vertebra, T9. How to find? In a standing position with the arms hanging down, the spinous process of T7 is approximately on the level of the inferior angle of the scapula. From there, count down to spinous process to the spinous process of T9. Bladder 18 is located on the level of the lower border of spinous process and 1.5 June lateral to the midline of the highest point of the paraspinal musculature. Or use the C7 as a reference point. From there, count down 9 spinous processes to T9 and locate bladder 18 1.5 June lateral to the lower border of its spinous process. Located on the same level are DO 8 on the midline, a point of EXB 2.5 June lateral to the midline, and bladder 47 3 June lateral to the midline. For the needling, 0.5 to 1 June obliquely towards the spine. In clinical practice, these points is often needled transversely, subcutaneously towards the spine. This allows the patient to lie in a supine position during needle retention. The needles can be secured with tape. Position, pneumothorax. For the action and indication, bladder 18 spreads liver chi, cools fire, clears, damp heat, regulates, and nourishes liver blood, subdues internal wind. It benefits the eyes, benefits the sinews. Special features, bladder 18 is the Back-Shu point of the liver. Bladder 18 can be used in most liver patterns, such as for stagnation of liver chi, retention of damp heat in the liver, and gallbladder, liver fire, blood stasis in the liver, liver blood deficiency. It is frequently used to move stagnant liver chi, causing distension of the epigastrium and hypochondrium, sour regurgitation, nausea, etc. In resolving damp heat, it can be used for jaundice and cholecystitis. As it invigorates blood, it can be used for abdominal masses from blood stasis. However, bladder 18 can also be used for liver deficiency pattern, such as deficiency of liver blood. In this case, it should be needled with reinforced method, or only direct moxibustion should be applied. When used to nourish liver blood, it can be combined with bladder 17. When needled with reducing method, bladder 18 can be used to extinguish interior wind. Finally, bladder 18 can be used to promote vision in all eye disorders related to a liver disharmony, such as poor night vision, blurred vision, floaters in the eyes, red and painful swollen eyes. Bladder 18 summary of functions: resolve damp heat for jaundice, clears heat, moves liver chi, and eliminates stagnation, distension, and pain of the hypochondrium, epigastric pain, abdominal pain, hypogastric pain. Brighten the eyes, blurred vision, red eye, diminished night vision, excessive lacrimation, redness, pain, and itching of the eyes, pain in upper orbit. Bladder 18 also benefits the sinews, lumbar pain, pain in the neck and shoulder, muscle cramps, pain in the sinews. Extinguishes wind, rigidity of neck and spine, lockjaw, opisthotonus, tetany. Nourishes liver blood, dizziness, blurred vision, invigorates liver blood, abdominal masses, stops bleeding, for coughing blood, vomiting blood, nosebleed. Bladder 18 is the Back-Shu point of the liver, where chi of the liver emanates from the interior of the body surface. And like all the Back-Shu points, especially those of the yin-sang, bladder 18 has a strong action on regulating and tonifying its corresponding Zang-Fu at the deepest level. The principal function of the liver are to maintain the free flow of qi, store blood, dominate the sinews, and open into the eyes. By spreading liver qi, nourishing and cooling liver blood, clearing damp heat, and pacifying wind, bladder 18 is able to regulate all aspects of the liver function. The increasing pressure of the prolonged qi stagnation easily transforms to fire. According to the essential question, anger will cause the qi to surge upward. If it is extreme, there is vomiting of blood. Since the liver stores the blood, the heat of the liver fire or liver yang may easily transmit to the blood, and given the tendency of the liver qi to rise excessively, cause reckless upward and movement of blood, leading to symptoms such as vomiting blood, nosebleed, and spitting and coughing blood. According to saying of Chinese medicine, the liver governs uprising, and anger makes the liver qi rise to the neck and shoulders. Stagnation of liver qi or uprising of liver yang therefore easily lead to stiffness and pain of the neck and shoulders. If liver fire or high fever consumes liver yin and generate wind, there may be such acute spasmodic symptoms such as epistaxis, lockjaw, rigidity of the neck and spine, and tetany. Bladder 18 is indicated for all of these symptoms. Thank you for your attention.